What's up, you guys? It's your boy Miguel here to give you your daily dose of radiation. In today's video, we are covering the beloved add-ons of X-ray, both for the night shift and the day shift. So I am an X-ray tech, night shift X-ray tech. Been doing it for over 4 years now, and I work a bunch of overtime, so I dabble in both sides of the team. I work at a Trauma 3 ER in the great state of Texas, and for those who are not familiar, add-ons means any extra exams that come in, usually between the hours of 6 and 8. It can be AM and PM. Usually those are, for us, night shift, are portable exams that got added on later because maybe the residents or doctors forgot to put in, because usually about 12:30 they spawn in AM. They spawn in all the morning ports, usually for chest tubes, for BiPAP, for people who are intubated or post procedures and stuff like that. Patient doctors and residents put the orders in, and that's our little stack that has to be done between the hours of midnight to 6 a.m. So depending on, I've noticed the trend, depending on what days of the weeks, what's going on around the hospital, the time of year, or even the residents, if they're the new first year, wherever they are in their little journey, the workflow will vary. So add-ons can, sometimes it'll be like a 6 o'clock timestamp, 6:30, 7. It used to be where anything before 8, regardless of PM or AM, was kind of your problem. But then sometimes in the emergency room, it starts getting busy and you can't go up to the floor. So our manager has cut it down to anything before 7 is your problem. But even then at 7, it's kind of still, you may get it, you may not get it as far as like going up to the floor. Unless it's like a stat. Certain floors have higher priorities. Like obviously if there's something like on the 5th floor and they added it on, we'll always do that. Other floors, it's like, well, you should have just put it in sooner, the residents. So, or sometimes they'll call because there'll be an order for tomorrow, but not for today. And then it'll be the whole back and forth of, well, there's an order. And then you're like, well, the timestamp is for tomorrow. For legal purposes, it's supposed to be done tomorrow. So there's always that situation that happens. I've noticed that more with people with chest tubes, or if they have, they're intubated. Because you have to worry about, there's something called the order set, where if a patient's intubated, the resident or the doctor will put it where it'll, for the next 7 days, there will be a chest x-ray order. And sometimes the patients get better and they get extubated. So you always have to check on the reasoning of the exam, because sometimes it'll spawn in at 12:30 at night. Let's say it's on the 5th floor, which is the ICU at our hospital. And then you look at it and it says intubated. And then you look at the patient, you're like, you're not intubated, so I can cancel that one. But then later on, around 6 in the morning or 7 or whatever, they'll put it in again, and then you look at it and it's like, pleural edema, or whatever medical reason they say, and you're like, so then I still have to do it, type of deal. But always be checking. I know sometimes during that hour, it's mainly our people at night, because of if they're routine, they don't get read overnight unless we change it to stat. What will happen is, if the doctors, mainly the doctors don't, it's more the residents at our hospital. If the resident doesn't see a report on their little side, it doesn't show up that it got done, so they think we didn't do it. So they'll order it again, so you always got to double check that if it didn't have a report, well, then usually it's a duplicate unless the reasoning is different, or if they call and ask. Because sometimes they'll call and then you'll tell them like, hey, it's been done, it just hasn't been read, and they're like, okay, never mind, you're good. Other times they're like, we need another one because of X reason. Patient got worse, patient got intubated, or whatever reason they give you. So always keep an eye out for that. But it's always a constant battle. Certain floors are more notorious to put in orders more, and then sometimes it will be bad to the point where I remember one time where it's like 7, between 7:30, we have like 20 add-ons, and we're just looking at it. You're like, "Whoa, this is a lot of orders coming in." Because sometimes you'll do the morning ports, and it'll be like 10, and you're like, "This is very small." There's probably going to be add-ons later, and depending on the timestamp, sometimes like we'll finish all the morning ports, and it'll be like 5 a.m. and then they'll come in at like 5:30 or 6, and then you're like, well, that's still our problem because of the timestamp. Day shift's gonna get mad that why didn't it get done? So there's always that beef between both teams, because in day shift they have more people. Like in our crew has between 4 to 5 people holding it down, and then the night shift there's only 2 of us. So, and depending on the type of season, that last hour, 2 hours, is when all the effery begins at the hospital. Like people going to sleep, falling down, meanwhile waking up in the middle of the morning. People going to work, all the chaos, all the NPCs in the GTA world, as I always call it, are out there getting hurt or trying to go to their jobs and always ending up at my job. And that's my problem. And it always happens. The morning rush or the PM rush. Like right now, let me see. Yeah. 1, 2, we got 3 EMSs chilling there. And it's almost about to be 8 o'clock. So usually anything that's spawned in routine at 7, they probably haven't done it because they're down here putting in work in the emergency room, which is fine. I mean, me personally, I would rather the emergency room get taken care of, and then if they call about the other exams, or we'll just get them during the morning ports. Like it's fine. But other people, other techs, it's mainly day shift. If they come in and there's a bunch of orders from like 7:30, they start getting on their feelings, and they're like, hey, why didn't get this done? And then sometimes we try, and then there's a bunch of activities during the morning, the nurses and doctors and stuff, so you can't always get it done. So that's always something to keep in mind. But I have noticed a trend at my work. Certain crews, because like in our department, there's like 2 different crews. We get crews of Xray tech people, like little teams that we get to work with. With some of them, we come in and there's never add-ons. And then with other crew, that it's like half of our 7 on, 7 off, they come in and there's a bunch of add-ons. And it always happens with them. So I don't know if it's, because certain days are more heavier than other days, and you would think it wouldn't be like that, like workload. But I've been doing it for so long, I pay attention to certain trends. And even if I flip it, and when I worked overtime and I was on the opposite crew of the night shift, their way of workflow was inverted to mine, as far as when it was more heavy workflow that causes the add-ons and stuff like that. As a regular person, or even as someone who's new to the field, you wouldn't think that. You're like, oh, Miguel, surely all this is random, and someone getting a chest tube, someone getting hurt, they're just trends that happen a little bit too much that would cause it to be a little bit more suspicious, which brings to my point of, I would, like, during my shift, certain days are more beneficial for you to take off just to avoid the workload. Or even the doctors, depending on who's the doctors on the floor, will cause more add-ons or less add-ons. So at the end of the day, we're just here to save people and do what we can, and hopefully do our best. I always try to do as much as I can, just because I dabble in both teams. I know certain of the night shift, they don't really care. They're like, it is what it is, Miguel, because they don't dabble in day shift like I do. I try to keep pretty good terms with both teams since I dabble in both teams. But yeah, it's been your boy Miguel. If you want some more videos, you can check them out on my channel. I post all types of aspects of this field. And if you want some funny humor memes, you can check the link below of my TikTok where I post some X-ray memes. And we'll see you on the next one.